Hi, and welcome to Pennsylvania Newsmakers, and thanks for watching. Well, recently, Governor Rendell announced the most sweeping health care changes in Pennsylvania's history. To talk about this subject today, we have one of the architects of the health care plan and several members of the medical community. We're going to get their response when we return.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, if you've been alive and well, breathing in the state of Pennsylvania, you know what Governor Rendell has done. He's just announced within the last couple of weeks some of the most sweeping health care changes. He's made these proposals to the Pennsylvania legislature, and he's now about the state, I think, as only Governor Rendell can do. He's here, there, and everywhere getting responses and arguing for these big changes. Well, it doesn't get any better than this on Pennsylvania Newsmakers. We have one of the architects of the plan, his policy director, Donna Cooper, who's been on the program a number of times. Her exact title is the Pennsylvania Secretary of Planning and Policy. Is that right?
That's correct.
Madam
it's
Secretary?
Not a problem, sir.
Got it. And joining me also, as usually is the case when we have these healthcare subjects, is Dr. Mark Piasio. He's the president of the Pennsylvania Medical Society. And Jim Redmond, he's the senior vice president for legislative affairs from the Hospital and Healthsystem Association of Pennsylvania. You know, getting all these titles out takes up a lot of our time. But let's go. Don, I want to start with you. Look, you agree most sweeping health care changes in the state's history?
Absolutely.
Why don't you just go through some of the... I mean, this debate is going to rage on in this state. Where's the governor now? Who knows? He's just out all over the state promoting this plan. But why don't you get into kind of why this plan? What are you trying to accomplish with this plan?
Well, look, we all know that there's Pennsylvanians who don't have health insurance, and that's a problem for them. They need to go to the doctor. They may be working in a company. They can't go to work because they can't get well. So it's a problem for employers if they have employees that don't have access to health care. But what's more important is that the skyrocketing health care costs are really hurting Pennsylvania's companies. And so what we're trying to do is say, look, there are things that we can control or do a better job controlling in terms of access to health care, quality of health care, and affordability of health care. So let's get about the business of getting that done. So how do we make sure that the close to 1 million Pennsylvanians who don't have insurance are covered? They cost all of us. When you pay your health insurance bill, you pay a premium to cover the person who's uninsured. How do we take care of making your costs go down by creating a subsidized resource between government funds and private sector funds to give private health insurance to that person? Then the second thing is, we all know that our healthcare systems are really struggling to do an outstanding job, and they by and large do. But we've all recognized in America that there are challenges associated with infections that we get in healthcare settings and with the need to improve patient safety. And so we want to try and drive those expenses out of the system in partnership with experts in the healthcare field. And then the last thing is that some of our settings in which we access healthcare may be more expensive than we need to utilize. So emergency rooms as an access to weekend health care is not really an efficient or smart way to run the system. So what do we talk about? We talk about covering the uninsured. We talk about uninsured workers and and people who are in between jobs. We talk about driving the system more aggressively to eliminate as much as possible hospital-acquired infections and drive down medical errors. And then last but not least, increase access in more affordable settings for basic primary health care or emergency needs.
All right, let's take up the pieces of that in a moment. There's at least 3 or 4 things I think we have time to get to. Dr. Piasio, what was the original reaction from the Medical Society when you folks got this announcement about this large-scale change in the healthcare system?
Well, first and foremost, we were very happy to be included in trying to formulate a plan, and we're comfortable with the basics or the principles of where the governor wants to go. Trying to eliminate waste and useless services in healthcare is a good thing. The patient safety initiatives have always been the backbone of our organization, where we 100% agree and cover all Pennsylvanians. If you don't have health insurance, not only do you have the cost issues and the business issues that Ms. Cooper was talking about, but you also you don't access the kinds of health care that you need in a timely fashion. We know that you don't get the health care that you need without insurance, so those are all good quality health care initiatives. what we're also very excited about is the push for healthy living initiatives, whether it's a smoke-free Pennsylvania or the obesity, the nutritious snacks in kids, and trying to change our lifestyles, which will help cost down the road.
Okay.
But those principles we're comfortable with, and we look forward to working on.
Okay, we're going to get into it. Again, good summary. Jim, Hospital Association, you represent all these the hospitals in the state. Take it.
Directionally, the governor's correct. We need to make the healthcare system more affordable, safer, and second, it is better to have healthcare coverage for those that are uninsured. We lack some details, and the governor has promised that those details will be made available. Clearly, a lot of folks are waiting for those details to fully understand the magnitude of this ambitious program.
Okay, we're going to have to go to a break. When we come back, we're going to get into the parts of these. And we'll take up each one. There are 4 or 5, Donna, that you mentioned that I think are worth talking about. We'll get into the specifics of the governor's proposal when we return, after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by Pennsylvania Medical Society. Doctors and patients, preserve the relationship. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back. We're talking about Governor Rendell's very ambitious health care agenda for his second term with Donna Cooper, who is the governor's a top brain on these policy matters. Donna's been on the program many times. So has Dr. Mark Piasio, the president of the Pennsylvania Medical Society, and Jim Redmond, who's a senior VP with the Hospital and Healthsystem Association. All right, Donna, let's go to the capstone of this, and I think you would agree, is this Cover All Pennsylvania program, which is the way in which the health care, in a sense, will be paid for. I guess that's get into some detail with that.
So basically we have about 7 out of every 10 Pennsylvanians who don't have health insurance are working. And so either their employer can't afford to offer them health insurance, or they're working part-time and so they're not payroll eligible for health insurance. And they cost the system, and as Mark points out, they get sick. We see them late, and then they're expensive when they're sick. So we want to cover them. So basically the state and the federal government are already spending money on some health care for working Pennsylvanians. We're going to redirect that money in a way that enables us to actually get more federal money and create a health care product that the private insurers will offer to small group employers, so they're employers with 50 or fewer employees, where there's primarily low-wage workers.
And you're going to mandate this?
We will not mandate it.
You will not mandate it?
No. An employer can offer this product to their employees, and their employer will pay about $120 a month per employee, which is about 1/3 to 1/5 of what they would have to do if they had insurance, if they could afford it. The employee, depending on their income, will pay anywhere from $10 to $200 a month for their health care. So if they're a person that's a really low-wage worker, they're going to pay $10 a month. Somebody earning over $60,000 in a small employer might pay about $280 a month. It'll range. And so the employer will pay some, the employee will pay some, and then we will redirect existing government funds to pay some to cover the cost.
How many people do you expect that program will cover?
Well, we think we have close to 800,000 adults without health insurance, and we're created the budget to ensure that if all of those sign up, there's sufficient resources to do that.
I think one of the things that I like about how they're looking to finance this, when you compare it to, let's say, Massachusetts. Massachusetts sort of has a mandate to jump in the pool in the deep end, whereas here the mandate is, okay, we're going to wade in from the shallow end, but we're going to have products available without mandating. In other words, Massachusetts mandated coverage, but it's not
for everybody.
Whereas now we're going to have a product that you're going to be able to purchase at a reasonable cost.
So, Jim, if I understand this, you can choose one option to continue to provide it as a company, or you can buy into this plan. Is that
well, a little bit different. It's only for small employers.
Okay.
And you can't be offering health insurance. You can't drop your health insurance.
I got it.
So there's what's called a 6-month go-bear period. So to avoid employers from doing that. But the way we get to large and medium employers who decide not to offer health insurance is we also charge anybody not offering health insurance a 3% surcharge on their payroll.
Okay.
One of the issues that I think we're all waiting for is really how do the numbers work. The governor indicated that the basic insurance program that Donna was talking about is essentially the current adult basic program, which is offered to these same individuals, but it's on a very small scale in terms of the numbers that can participate, about 50,000 people. That program they're going to add two new benefits, prescription drugs and behavioral health. Now, the current cost of adult basics is $320 a month per individual.
Right.
Governor has indicated that that's going to drop to $280. That's raised a lot of questions about, well, wait a minute, you're going to add benefits, but it's going to cost less.
Yeah, I mean,
Massachusetts, for example, has put in place a similar kind of program, including a mandate. Their costs are in the neighborhood of $380 per month. So we've got to see the further details in terms of how this is going to work.
The cost of these per month actually don't seem unreasonable given what, you know, we've had a lot of small business guys, men and women on this program. They're saying they're spending $10,000, $12,000 a year. Right. But the other thing, Donna, that I thought, and maybe I'm wrong, I thought that the governor's point was that no matter the size of the company, the employer would be able to purchase insurance through the CAP program.
No, the employer can sign on if they're a small employer, but if you're an employee working for a company that doesn't offer health insurance, you can sign up as an individual.
Oh, so you can sign up then regardless of the size if it's not covered.
Right.
Go ahead. Did you want to?
No, that's
all right.
Correct.
One of the issues in terms of being lacking a mandate, one of the things to watch for is there will be a tendency for what is known as adverse selection. In other words, those that are sick or think they're going to be sick are likely to sign up. So the cost, again, of this program is not going to be spread out among a large number of individuals like they're trying to do in Massachusetts and California.
All right, when we come back, go ahead.
I think one of the challenges in that is that when we look at Pennsylvanians and we talk to them and we say, if you had a health insurance product that would cost you $40 a month, would you buy it? They say yes. The issue right now is not the desire to be covered when you're healthy or sick, but the affordability. And this plan goes right to affordability for the individual. All
right, we got to go to break. One of the other subjects, there are a couple other ones that we want to get into. One is chronic care, how we're dealing with the team management of that, and hospital-acquired infections. We have, with Jim Redmond here, we want to take those two subjects up along with Donna Cooper when we return.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Credit Union Association, Pennsylvania Credit Unions, where people are worth more than money, and by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education, 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to Pennsylvania Newsmakers. We're talking about Governor Rendell's health care agenda. All right, Donna Cooper, let's go to one other aspect, and it's a subject that's been on the table for a long time. We'll get Jim's response in a minute, and that's the problem with hospital-acquired infections. What's the purpose and what's the goal of the governor's program in this regard?
You know, Pennsylvania is really lucky because we have a lot of information that's been collected about the impact of hospital-acquired infections and the cost. And Pittsburgh is at the forefront of the nation in really driving down hospital-acquired infections by changing how their hospitals operate. And they've taught us all a lot. And we know right now that at a minimum we're looking at about $3.6 billion of costs in the system due to these infections, aside from the impact on the individual. And the Hospital Association and all the hospitals in the state, I think, are very excited about thinking collectively about how we sort of accelerate the systems necessary to drive down the infections and the costs.
In the discussions that, the governor's been on, television a lot, and he's brought this up a lot. This is a big part of what he's trying to accomplish, right? So it's not a kind of tertiary, it's not a little bit. It's not a little bit.
Not at all. And it's mostly because we've learned so much from the great work of the hospitals in Pittsburgh.
Jim.
Two problems in terms of just trying to understand this issue. First of all, the governor has expressed those savings in terms of charges. Hospitals are not paid charges.
Right.
Actually, statewide, hospitals are paid about 30% of what the charges are. So even if you were able to eliminate healthcare-acquired infections, you wouldn't achieve the savings.
The savings, go ahead.
The second thing is that, as we understand the numbers from the governor's office, they've included the cost of the entire admission. So somebody is coming in for a knee replacement, might acquire a healthcare-acquired infection. The savings is projected in terms of eliminating that entire admission.
Right.
Well, that's not possible.
Right. So these are some of the things that...
But I think fundamentally you would say there are savings associated with driving down hospital-acquired infections. We're all paying for that right now, so we all have to work to take care of it.
I
we can
agree.
quibble over the numbers, but the challenge before us is addressing the problem.
But it's a degree of magnitude. Plus, we want to make sure that there are incentives in place, not just simply cutting hospital payments.
Yeah, we look at the from the physician perspective, eliminating infections is again central to our core. As a surgeon, as a knee surgeon, it's about the one thing I fear the most. So what we have learned from Pittsburgh is that with some very dedicated processes, we can lower that risk, sometimes close to eliminate the risk where we thought that was not possible.
Right.
But those processes, they're going to be expensive.
Right.
What the savings are going to be, I'm not sure. But in terms of health care, we're going to be happy with the outcome by eliminating.
So let me get this straight.
But it's interesting,
Go ahead.
Terry, let me mention one thing. I think Mark's so onto this, which is with dedicated processes. In Pittsburgh, one of the ways that the Presbyterian Hospital and the VA Hospital address this was about $113 in intercepting the way in which the MRSA infection is spread throughout a hospital. $113 to really drive down something that extends the number of days you have to be in the hospital and number of antibiotics you have to take and cost.
Right. So let me get this straight. So, I mean, everybody's in agreement here that we ought to work diligently, and I think, is it the Cost Containment Council that these reports were given that we've talked about on the show a number of times? Everybody's in agreement. The only thing that you all are debating at the moment, it seems to me, is how much savings you'll get, and that needs to be worked out. Is that...
That issue, as well as how do you get there? How do you provide some incentives for the systems changes and the changes that have got to occur in our healthcare delivery system to eliminate that?
All right, Donna's looks shaking her head like she's in agreement with that. When we come back, we're going to take a look at chronic care, how that all needs to be managed when we return.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Builders Association, building today for a better tomorrow, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to Pennsylvania Newsmakers. Okay, Dr. Piasio, chronic care management, I guess, teams get involved in a lot of patient care. There are cost drivers. I mean, obviously, there's some good, but there's cost drivers to that. The governor wants to include that in his plans.
Part of what we like about the plan is there's always going to be a lot of debate on a lot of particulars, but there are a lot of cost drivers or excessive costs that are avoidable. And those are the areas that we're very happy that we're starting to address because that's the fruit that we can easily get to. And one of them is chronic disease. I think we most know, you can argue how close the numbers are, but about 20% of the population consumes about 80% of the healthcare resource. And a lot of that is because of just poor chronic disease management, the asthmatics, the congestive heart failures, diabetics. And if we've learned anything over the years, that a good team approach, a collaborative team approach, physician direction with allied health professionals, PAs, nurse practitioners, nutritionists, pharmacists, physical therapists, podiatrists, all these various groups playing into a team concept of taking care of that chronically ill patient seems to get a better outcome, lower hospital utilization, and overall lower cost. So he's looking at ways of, well, how do you compensate a team collaborative like that in trying to manage chronic disease? And we really haven't had it in the past.
I mean, so now everybody just sort of gives their bill for the time, and
it's very fragmented, and it just doesn't have the same kind of coordination. And a lot of that just comes from how, they always say, follow the money. And how do you compensate a team?
Have to be reorganized? I mean, go ahead. The way they do.
Well, in many of the points that Mark has pointed out, we are moving rapidly in that area. But the other great challenge with respect to those that have chronic illnesses is also patient compliance. And it requires a great partnership on the part of the patient. So we've got to do a lot of educating of patients to be able to monitor their blood glucose, their weight, their blood pressure, their medications, and it becomes especially challenging the older you get. I mean, in terms of those that might have dementia or Alzheimer's, I mean, it is really, really difficult for the healthcare community to manage these patients.
Donna, let's sort of pull this together. We may get to the nurse practitioners, but if we don't, that's okay. We're going to do a whole series of shows on this healthcare, these changes over the next 6 months. But let me lay this out. I mean, where does all this go? This has to go to the legislature. You've got, originally it was talked about as 47 bills. As I think you appropriately point out, you're going to amend a lot of bills. I mean, how do you get a handle on this? I mean, help our viewers out. How to get a handle on this?
It's tough. There are several processes that have to be in place. The first and most central one is the legislative process. And on February 6th, the governor will deliver to the legislature the draft health care bills, which will be the beginning of the conversation on the details.
Okay.
And not only will the legislature be involved, but the professional societies that have been involved in the planning and whose ideas we put together as we understood them best begin to be a conversation. And we hope that we can finish a good portion of that conversation between now and the end of June and get a lot of things legislated and underway. But for instance, on chronic care, we need to bring together the doctors and the hospitals and say, how should we best reimburse for this? What are the ways that we don't create perverse incentives? And create a chronic care reimbursement model. So we'll probably finish that between now and the end of the year.
Will that be done legislatively, or is that jawboning and just get...
First, we have to work together to create a model, and then we could start reimbursing in medical assistance. We're a big purchaser, and state employee benefit systems. We're a big purchaser.
We have about 30 seconds. Is there 30?
So there's a stakeholder process, and then the last process is that we have a regulatory process where we look at maximizing the training that people have, whether they're nurses, physicians assistants, doctors. Everybody's training has to be brought to bear to make people well.
Okay, well, look, we're going to get you all back maybe in May. If you all agree, you'll come back and we'll sit down and we'll see what progress. This looks like it's going to take more than a couple of months. It's the biggest change. All right, we'll see you next week for another edition of Pennsylvania Newsmakers. Stay well.